Well, the way that local Zika virus transmission would occur would be that a mosquito would catch the disease from a person who's infected. So a traveler who was infected in an area that has Zika virus transmission would return to the U.S. and a local mosquito could bite that person and then transmit the disease to someone else. Now that's the definition of local transmission, and that would be how it would occur. There are a couple of ways that could be prevented. One is that just in general, conditions in the United States are such that the chance of a person being bitten by one of those mosquitoes is lower than it is in many parts of the world, or in parts of the world where there is widespread transmission. So generally, we live in places that are air conditioned, places that have the vector. We have air conditioning, we have screens. We don't generally live in houses that don't have screens and where mosquitoes are sort of in and out of our houses. The Aedes aegypti mosquito in the United States is principally an outdoor biting mosquito, where in countries that have widespread transmission, because of the housing, they're generally bite indoors and outdoors. So this air conditioning and screens are really, really important. We have air conditioning in our cars, so there's actually not that much time when we're outside. And again, as a population level, the proportion of people who are outside all day long is much smaller in the U.S. Than it is in countries that have widespread transmission. In places that have the vector in abundance, there are local measures that can be undertaken to prevent an introduced case from becoming spread into the population, and so that's where a traveler-associated cases identified in local vector control measures can reduce the chances that those two things that we talked about wouldn't happen. One is that person wouldn't be bitten by a mosquito, and secondly, if they are, that mosquito would be prevented through the vector control measures from biting another person.